All right, thanks, Chase. Real quick, we'd like to welcome everybody out to our Live On virtual town hall with First Lady Abby Cox, Wasatch County Schools, and the Live On Suicide Prevention Campaign. Real quick, before we turn the time over to our participants today, we do have a Q&A and a chat feature active on today's webinar. And we invite all those that are attending, if there's any questions for the students or for the participants today, to please populate those in the Q&A throughout the formal portion of our presentation. And at the very end, we will turn it over to our guests today to share and answer some of those questions. So with that, I'm going to turn the time over to Trudy, who's going to walk us through today's event and share with us a little bit about why Live On and suicide prevention is important as part of this webinar. So Trudy, let me turn it over to you.
Thank you, Steve. I'm Trudy Brereton with Wasatch Behavioral Health. I'm the prevention coordinator for Wasatch County. And I'd just like to thank you all for joining us today on Zoom. I'd like to give a very special welcome to Utah's First Lady Abby Cox. Thank you for joining us today. And I'd also like to welcome our leadership from our Wasatch County School District, the Utah Department of Human Services, and all of our student advocates, champions, and supporters. We can't do this without you. And we offer our most sincere appreciation to Live On, as they continue to empower all of us to engage in conversation about such important public health issues. Now I want to take a minute to talk to our students on this call today. Suicide is a leading cause of preventable death in Utah and takes lives without regard to age, income, race, or gender. The ongoing goal of this school-based effort is to establish mental health and suicide prevention as a priority for all our students and faculty. Your wellness and health is top priority for us. Together as students, educators, and community members, we can continue to promote protective behaviors and beliefs. We can normalize seeking help and help reduce the stigma around mental health. We know we can provide hope and encourage positive and supporting relationships among all students. Now we are proud to announce that starting today, Live On, the Utah Department of Human Services, and Wasatch County School District will launch an in-school mental well-being campaign to truly engage in conversation around reaching out, lifting others up, and preventing suicide. It is a true pleasure to share the latest series of Live On messages that are aimed at helping all students feel love, hope, and opportunity. Here you see a new series of messages for our students and educators, and these messages will be supported by several resources available to all members of our community. It is not every day we see such an important message installed inside our schools using such creative tactics, conveying a message of hope, opportunity, and love. All of Wasatch County is proud to be working with our Live On campaign and the state of Utah to raise awareness to educate our students on the issues related to mental health and suicide prevention. I would now like to introduce one of our greatest supporters, Utah's First Lady, Abby Cox. Mrs. Cox.
Thank you. I am so excited to be here. First of all, I would like to express my appreciation to all the students on the call today. I'm so overwhelmed with your dedication and commitment to help improve the lives of your peers through empathy and connection. This doesn't happen without all of us working together. So I would like to thank our public and private organizations that support and help make this movement possible. Teachers, educators, and principals, thank you for supporting such an important public health issue for both your students and for Utahns everywhere. Thank you for being the caring adults in our children's lives. Now, I believe that we learn best from the people that we know and trust. That's why we have partnered with our teachers and educators and many leaders from the Wasatch County community. This group gathered today has been instrumental in helping to spark the conversation with our student population, focused on in-school relevant messages to inspire hope and understanding, to this very sensitive topic. We know that with leadership and the support of our young students, these messages can lead to vital conversations that will save lives. I too want to take a minute to talk to our students. You are such an inspiration in Wasatch County. You can become a powerful voice. Your actions make a difference. You can show up for one another, and you can give one another hope, and you can make a difference. Connection is the key. And don't forget that your teachers, parents, and community are all here for you. Live On is a statewide effort to prevent suicide by promoting education, providing resources, and changing our culture around suicide and mental health. If you are listening to or reading these messages today, you can play a role in suicide prevention. We encourage you to visit liveon.org for additional resources on how to get help and how to give help. I personally invite, or better yet, challenge all of those in our education community to help shift the social norms related to mental health and suicide. Help us to make a difference and save the lives of your friends and family. Now, I want to stress that this is not just a health concern in Wasatch County. It's among our student population throughout the state and also our non-student population as well. I believe that Utah is a unique state with a unique culture, and it's up to us to come together to reduce judgment and stigma around mental health issues. So those who are struggling can find help in a community of openness and understanding and support. I'm proud of the work we've done and the progress we've made, but like all of you, I recognize that there needs to be more done. I would now like to introduce Rachel Heath, a student at Wasatch High School and a true advocate and champion for positive change among her fellow students. Rachel.
Thank you, First Lady Cox, and thank you for your support and commitment to helping our schools be better prepared to talk about suicide and mental health issues. Your leadership is inspiring, and we are truly lucky to have your commitment. So we are here today representing our schools to tell the students of Wasatch High, Rocky Mountain Middle School, and Timpanogos Middle School that it's okay to talk about our mental health. Sometimes it takes only one conversation to make all the difference. We understand how important it is for students to be able to talk to other students about and our educators about mental health, depression, and suicide. We need to become listening ears and open our hearts to those in need of support, hope, and love. This past week, I had the opportunity to open my heart and just listen to a friend that needed that support, hope, and love we are talking about today. I had been going through similar difficulties with stressing out about school, senior year, and graduation, along with doubts about myself, self-worth, and my future. I saw that my friend was looking a little down during one of our classes, and just through a simple question of, "Are you doing okay?" was I able to give room for my friend to open up and share with me what she was going through. We both found comfort in talking to each other and giving one another hope and a positive outlook for the future. Together, we can make a positive change in our school that will help to create a lasting impact for years to come. I would now like to introduce a fellow student of mine, Riggs Lloyd. Riggs.
Thank you, Rachel. I believe most students on this call today would agree that the pressures of schoolwork, having a social life, and social media can be stressful. Sometimes we may even feel alone or even forgotten. That's why we need to be aware of one another and be attentive to each other's needs. Essentially, if we know the warning signs, we can help our fellow students through dark and challenging times. Most who have died due to suicide will give a clear warning. Together, let's watch for these signs and listen to our friends and ask them if we can help. It's a big role for us students, but I know that we have the power to save a life. One time, my friend was really stressed out. She'd just gotten into a fight with another one of our friends, and she called me. So we talked for an hour and listened to some of her favorite music till she had calmed down again. Now, a challenge to my fellow students. If you think somebody might be considering suicide, ask them. Asking doesn't make them more likely to attempt suicide and may actually save their life. Then connect them with a trusted adult for further support. Remember, you're not alone in this. And now I'd like to introduce Madison Lofgren. Madison.
Thank you, Riggs, and thank you for the challenge. Together, we will help our fellow students and we will show hope, friendship, and love. Like many of those on this call today, I believe that everyone at the school has a role. Counselors are here to guide and inspire, teachers are to mentor and educate, and even counselors or even coaches are here to train and lead. But I want to talk about the role that students must play to ensure all of us are successful and healthy. It is our responsibility to lift each other up, inspire positive engagement, and become a true friend for all of those around us. Our coaches, counselors, teachers, and even fellow students can play unique roles in ensuring all of us have a successful future. It may seem like a daunting task, but we can save lives if we engage in hopeful conversations with those struggling. A scholastic book study shows that one of the most common concerns for middle school kids is not having friends. This year, I've had the opportunity to work with kids with special needs at our middle school. We are able to build friendships and help them feel more included. We can all be friends to everyone we meet and help them feel loved. I speak in behalf of all my fellow students that we want to live. We want our peers and friends to live. We are committed to helping each other find ways to face the good and bad days. Together, we can live on. I would now like to ask Mr. Ben Springer to share a few words. Mr. Springer.
Thank you, Madison and Rachel and Riggs and First Lady Cox and Trudy, everybody who's supporting this liveon.org movement in the state of Utah. We're really fortunate to have such awareness and such a wonderful campaign in our high school and 2 middle schools. Wasatch County is growing like crazy, and it's so important to see all you students on this Zoom call in these Brady Bunch of boxes. I'm so grateful for you. I'm grateful that you're willing to join this and reach out because we need you, right? Like our community needs you. And the bigger we get, it's more important that we establish these connections for people moving in and for the people that have been here. And it warms my heart as the representative of the school district. I'm the director of special education to hear Madison talk about working with students with special needs in our district. That's what it's all about, this service and this awareness. And as a school district, we couldn't be more proud and grateful for this awareness. So just a big fat thank you to everybody on this town hall, the Zoom town hall. And just to let you know a little bit about what Wasatch County is up to, we have Trudy and Wasatch Behavioral Health, who just works tirelessly. Every meeting that I go to, Trudy is there behind the scenes doing something. And it's folks like Trudy and it's students like you and everybody on this call, all the way up to First Lady at the governor's office about this type of awareness. And in Wasatch County School District in our beautiful Heber Valley, the past 3 years, we've started a Wasatch Wellness Initiative. And a lot of this is just in conjunction with our school counselors who work tirelessly every day to support students, our educators, and obviously our school board has supported this. And what it is, it's basically a wellness center. And we feel like it jibes completely in harmony with this Live On movement and awareness campaign about providing families and students resources outside of the school setting. So after hours in the Family Education Center. We couldn't be more proud of this partnership. We do a lot of this work with Wasatch Behavioral Health. And we are so excited to see all of this awareness in our hallways. And just remember, it's more than a poster, right? Everybody on this call, I want you all to look at those posters and let's have it mean something, right? Let's have it actually have some meaning behind that poster, because there's nothing worse than feeling awful and seeing a poster that says, hey, we're reaching out. So let's really do the work. And Wasatch County School District, the school board, our community, we all support this. So thank you all so much for the opportunity. And let's just live on. I love it. Thank you so much.
Thank you, Dr. Springer. I would like to thank all of our speakers today for joining us in this rally for our young Utah students. I'm excited to see the positive effects of this in-school mental health campaign and how impactful it will be in the lives of this community. I again would like to thank Mrs. Cox and the entire team responsible for Live On for helping to address such a vital message for all of our Utah students. We know that suicide is a leading cause of preventable death in our communities and takes lives without regard to age, race, or gender. Preventing lives lost in our schools and communities starts with all of us. The Live On campaign is important and it's effective, but it only works when all facets of the community come together to shift social norms and reach out to those who are struggling. We have access to an incredible resource at liveonutah.org, which is aimed at helping the community understand and respond to mental health and suicide challenges. We owe it to our kids, our students, and our community to face these health issues head on. Together, we can get through, reach out, lift up, look ahead, and live on. Together, we can save lives. Thank you. We're now going to take some questions we've had post in our chat, in our question box. We have a question coming in that says, what is one thing another student or an adult has done that has helped you feel or be seen and feel seen and connected to them? Rachel or Riggs or Madison, do one of you guys want to answer that?
Well, personally, I felt seen and like I've been reached out to. One of our counselors, Miss Watts, reached out to me when I was like having a rough day. She emailed me asking if I was okay and if she wanted to come talk to me when I came back to school the next day. And it really resonated with me.
Great, thank you, Riggs. Another question we have is, what is something an adult should avoid when trying to help? Rachel or Madison, do one of you guys want to answer?
I feel like it's just really pressuring the kid to just feel like they have to spill everything out, and more like letting them decide what they should feel is right for them to let out. Like sometimes they don't always want to shout to the rooftops all their problems. Sometimes they just want to be heard and looked after for just 15 minutes.
I would agree with Riggs on that, a lot of times students, they just want to have a place where they can go and they can be heard and they can just feel love and comfort from people. And so whether you're a student or an adult, just being there for someone and creating that environment of love, I think can help people be able to feel like they're being helped in that situation.
Another question for the students. What would you tell your fellow students about how they can reach out and be a part of this Live On movement?
Honestly, just asking our counselors. That's how I got involved. One of our counselors referred to me to have this speaking position today. And I said yes, because I thought, why not?
Okay, another question. What is something that a friend has done that is supportive that maybe isn't typical mental health or suicide prevention, but was super helpful?
Sometimes they just talk to you and then ask you how your day is, and it doesn't have to be like, are you okay? Like, are you okay? Are you struggling? It can just be like, how's your day been? Like, what's your favorite thing you've done today? Or something to that extent.
Thanks, Madison. Here's a question for First Lady Cox. Was there someone who was important and supportive to you as a teen, and what was helpful?
Thank you. Can I just go back a little bit to the question that was asked to the student? Talking about students that maybe it wasn't a big thing, but I've just watched a couple of things in my kids' schools. One thing was there was a big assembly last year. Obviously, it was before COVID, and walked in and it was a talent show, and I remember seeing these kids, and there was a girl that got up, and I know she has some special needs, and she decided she was going to dance, and I just sat there just holding my breath, thinking, this isn't going to end well. They're going to they're going to ridicule her. This is, you know, I was so anxious watching this. And I just started to cry because these kids, they cheered with everything in them for this little girl, and just made her feel like she belonged. And it was actually really beautiful. And then another experience I had, my son was just in the high school musical. They were able to actually do it, you know, in front of an audience, which was really powerful. And we weren't sure that was going to happen this year. But he had there was a transgender child that was in the play with them. And he didn't know him that well, but he had started to become friends with him. And by the end of the play, he said, he is genuinely my friend. And they just really made this powerful connection. And so I think the peer-to-peer, that friends are so important, and connecting with somebody that's different from you. And I guess I would just say to your question that there were adults in my life, some youth leaders that were really a powerful connection to me. I was feeling, I think as a senior, I was feeling kind of adrift, like trying to head off to school, but I was still in school, head off to college. Where was my place? And there was a really caring adult in my youth group that just reached out to me and became a really good friend. And again, just someone to talk to, someone to just feel like I belonged with them. So that it was just mentorship, and being that caring adult is really powerful.
Thank you, Mrs. Cox. We have another question for you from Ariel with KUTV. She said, your husband, Governor Cox, shared in the last several years that he considered suicide as a youth. Please talk about that and the role it plays in the work you are both so passionate about now. Also, any additional advice to students who may be struggling to feel comfortable reaching out for help?
I think in the past, I will say that we, especially when we were youth, and when, you know, my husband was going through his really difficult time with his parents were going through a divorce. It was really, really tough time. And sometimes we have those situations. I think it's really important for us to share those stories, because our students can then see us on the other side of it. They can see that we powered through, that we got the help that we need, that we connected with people that were caring, and that we were able to get through that. And I think that's a really powerful message that we need to share. One of the students said that I think in the past, you know, maybe as youth, for us, we were kind of told, like, don't talk about suicide, don't talk about it, because then people will have that idea. And the research that we see now just does not bear that out. It actually is quite the opposite. When we talk about it, when we share, when we ask someone how they're feeling, and if they need help, and if they are contemplating suicide, that actually does the opposite. It helps people to live on. And it helps people to see the hope that they can have as they get past these tough times.
Thank you for sharing that. This question is for Ben. If someone would benefit from crisis services or mental health services, where should they turn to?
That's a great question. And that's something that, you know, obviously through this whole kind of movement and awareness campaign, we hope is the result of it, is that if you know anybody that is in crisis or in need of mental health services, our public schools are an excellent first line to discuss. We have well-trained school counselors here in Wasatch County School District in every building. We also have school resource officers available in every building for really serious situations. So as difficult as those challenges may be, just like everything we want to offer the community, student safety and family safety is our #1 priority. So reach out to anybody in the school setting, and we can get you in contact with those services. We have excellent relationships and partnerships, like I said, with Trudy's agency and Wasatch Behavioral Health, as well as our local hospitals and clinics around here. There is a network of mental health providers in Wasatch County, but it's probably not that dissimilar from the Wasatch front. There's waiting lists, and there's a lot of folks that are in need right now. So really any little bit helps. And we're really fortunate in Wasatch County School District to have these well-trained mental health professionals and counselors everywhere. So just reach out, touch base with us, and we can plug into those networks.
Yes, and I would just add on to that, at Wasatch Behavioral Health, we do provide counseling services. We recently just implemented an MCOT team, which is a mobile crisis outreach team with people who are available to go out on nonviolent crisis calls to help people who may be in a mental health crisis and then refer them to get the help they need. And so we do have resources. You're always welcome to call Wasatch Behavioral Health to learn about more resources we have available in our community. Another question, students, what do you feel hopeful about? Maybe we'll have each of you answer it. We'll start with Rachel.
Is this referring to just life in general or the suicide campaign?
I think life in general.
I feel hopeful about all of the, I don't know, kind of future events that are happening in our lives. Like things are opening up slowly because of COVID restrictions now, where things are opening up, and I think that's a lot to be hopeful about. And then just as a student athlete, I think having those sports and having those extracurricular activities that I do, that gives me a lot of hope and I don't know, a very positive outlook for life. And so I think just as like to encourage people who may be struggling right now, that when you get involved with things, they bring extra stress sometimes, but it's also a way for you to go and connect with other students and other advisors and to get that social interaction that we kind of all crave.
Thank you, Rachel. Madison.
I'm just really hopeful. There's a lot of things, but I'm really hopeful for like the future, what it holds and what happens like next year. We got to pick our classes this past week, and I'm really excited for those and hopeful. And that's, yeah.
Okay, thank you. Riggs.
I'm personally feeling hopeful for the change that we're doing today with this webinar happening. I'm just hopeful that everybody will now feel more comfortable with sharing their mental health issues with one another and being more comfortable with like comforting one another and like knowing that it's not a taboo thing, that like most of us go through things like this. It's not just you, it's everybody.
Thank you. Very insightful answers. Thank you. Another question for our students: how do you intend to create positive change moving forward in your school?
Personally, I think I'm just going to smile more and talk to more people, ask how their day's going. Honestly, even just asking somebody about their day can make the world of a change.
Yeah, right along with Riggs, I think being the first example and showing other people how to love and how to comfort other people, I think will be the best way of changing others' lives. And I know that personally, like when people, kind of when I was a freshman in high school, a lot of people would come up to me like, oh, how are you doing? They'd ask me about my day, what I've been doing recently. And it would just be super nice. I'm like, oh, I'm going to go do that to other people now because that made me feel so good. Now I want to go share that with other people. And so I think that just being that example and just showing other people love, I think will be the best way to change.
Thank you.
I think joining like clubs or talking to people, doing other extracurricular activities and getting to know more people will help.
Thank you, Madison. Thank you to all of our students on here. You guys are truly inspiring. I'm just going to offer Mrs. Cox the final word on ending our press conference today, and you can talk about how you give hope.
Thank you. I appreciate that. What gives me hope is these students. Every time I meet with young people, we've brought groups of educators, and we actually had a whole group of students in here that we at the mansion that we talked to about these issues. And I feel so much hope anytime I'm around students because I see the power in them, and they're the ones that are teaching us how to deal with this. They're teaching us how to be kind. They're teaching us empathy. They're teaching us how to connect with one another. There's maybe hasn't always been, especially in the last several years, these students see a lot of behavior that's modeled in the public sphere that maybe isn't what we hope for. But what I hope, what gives me hope is to see these youth and these young students providing hope for the adults in their lives. But we want to connect with them, and we want to be that caring adult in their lives. So mentorship is huge. We all need to connect with this together and really provide this campaign the boost that it needs to make sure that everyone knows the resources that are available to live on. So go to liveon.org and let's do this together. Thank you.
Thank you, Mrs. Cox. And thank you to all of our students who are going to take these messages out to their schools. You guys are really awesome.
Thank you, Trudy. And that concludes our media event for today. In the chat, you also notice there's a link to a digital Dropbox with all the content we talked about today. And we will also be sending out a link to this recording to those that attended our session today. So thank you, everybody, for participating. And special thanks to all of our students and for Mrs. Cox for joining this 30-minute rally cry to create change in our schools for suicide prevention.